Hello, everybody. This is Talia Frazier. You can call me Mrs. Frazier. I am doing the second week recording for Introduction to Public Health. I'm doing these videos. I wish we were live. I wish we were in a classroom, but we're online, okay? And we have 7 weeks to go. Okay, so we're covering chapters 6, 7, 8, 9, and 10. So covering those chapters today. Again, these chapters are short, okay? And you might have to watch this recording a few times because some of you have not seen this kind of stuff before and you're learning about it. Some people, they've seen it or they work in the medical field and they're familiar with it. So depending on where you're at, if you're just coming into college too, there's a lot of different variety that I have with you guys. So that's okay. If it's familiar, great. If it's not, that's okay too. That's why you're here. That's why you're learning. And another thing, because this is recorded, it's hard to not see your faces. So I'm just going to keep rolling with it. And if there's things that I think about, I'll stop and pause and reiterate things. Okay, so let me try to share my screen with you guys to go over what we're going to be talking about today. Um, we'll start with the lecture, but another thing that I want to get going and making sure that you're aware, so we're going to do module 2, week 2. I will have a page on there to review on what discussions you're going to be needing to do. You're going to be needing to do some watching of some videos. I encourage you to watch all the videos that I recommend, even on this lecture. Watch it. Um, Great detail, great information. It breaks it down even more for you, and that's what I want. Okay. Again, these chapters are very short, so if you're feeling overwhelmed, that's okay, because usually this class is taught in 16 weeks, and we're doing it in 8, and it's summertime. So again, I want everybody to pass. I want everybody to do well. So please email me if you have questions. This is our week where we're having our first quiz on 6, 7, 8, 9, and 10 chapters. There's around 30 questions, 30 points, true, false, multiple choice. It's going to be timed, and you get one extra attempt. So you get 2 attempts, okay? And the best one is the highest one that it'll take, okay? So please review all the lectures, this video, the videos that I recommend for you beforehand, okay? And you have a whole week if you're starting on Monday, the 29th, and then you have until, I believe, the 5th to get that quiz done. But I recommend do all the reading first, do this video, do it a few times. If you're not familiar with a lot of this, that's okay. So let's get started on the lecture here. We're talking about, and we're jumping into chapter 6, okay, which is problems and limits of epidemiology. Now, epidemiology is the study of diseases, where they're tracked, how they're done, things, and why that disease happens. That's what epidemiology is, the science behind it. Okay, so we'll go more in depth of that, um, and kind of brush a lot of other different things. Okay. So learning objectives for this chapter, we're going to identify encounters where studying humans in epidemiology studies, so the past, what we had to do in the past to get to where we are now, okay? We'll describe reasons why epidemiological studies can result in incorrect conclusions. That's just what happens. That's how we do trial and error. That whole thing with trial and error, that's how we figure it out. Okay, illustrate factors that can utilize to prove cause and effect in a disease, understanding that concept. Give examples, we'll give examples, or I will give examples of past ethical abuse and epidemiological studies, and some guidelines now that have been established because of those past abuse with people who didn't have a choice, unfortunately. But they made the way and they paved the way for us to live longer, to have cures, to understand a lot of different things. So their sacrifice did not go um, unknown, meaning we figured a way of understanding the process, understanding the disease. And it's a very unfortunate and wrong of what was done, um, but more of understanding. Okay, now we have more respect of when people do clinical trials and studies, thank goodness, and we have a choice now. back then they didn't have a choice. Okay. We'll explain the pharmaceutical industry and how misleading information can manipulate results in clinical trials, how it can interfere with a lot of it. Okay. All right, so a lot to cover. Okay, so problems with studying humans, intervention, study problems. Subjects may follow prescribed behavior throughout study periods. Sometimes we don't know what they're doing. Sometimes there might be a confounder variable in there that we don't know about. Cohort study problems. Sometimes it is hard to isolate which of the following many factors can interfere with it and responsibilities of health differences. Sometimes they don't know a certain disease that they may have unless they've had additional testing. So there becomes problems that happen in these studies. Case control studies, problems that happen. Control group may not be truly comparable. Also, errors may exist in reporting or recalls. Unfortunate. For studies, difficult dropouts. Also, dropouts may happen during that time. Like any other study, they just don't make it. Sources of error, random variations, where variations aren't really, they're conflicting. Okay, confounding variables, factors that can be associated with exposure that may be independently affect risk of developing the disease. So depending if, like fish oil back in a few years ago, okay, do fish oil to help reduce cardiovascular disease. Now they're saying, no, you don't need to do that, just diet, lifestyle changes, exercise, healthy lifestyle. So there's a lot of contradictions that can source of error where they're saying, oh, it works, and then they come out with another study, it does not work. So that's the thing with these studies in the clinical trials, they're still trying to find out information, they're still trying to have a lot more, that's why time, okay? Time. Bias, selection bias, reporting bias, or recall bias. They have a bias of certain reasons of why they're like that, and we'll go more in depth of that. Okay, factors that can lead validity to results. So strong association, dose responsibility, dose responsible relationship, known biological explanation, large population group can be a problem, consistent results from several studies, high relative risk of odd ratios, okay, risk or odd ratios. So they're not really, it's kind of going teeter-totter. It's not balanced out. Hormone replacement therapy, this was done mostly, it was popular in the 1960s. Be aware of that. This will be on your quiz. And conflicting results is this between two major studies, previous positive evidence that all come of observation studies. Okay, clinical trial is the gold standard for this. Resource of results of cohort studies were confounded by associating factors that made women take heart healthier even without the therapy. So they've had a lot of contradictions with this and doing it properly than before. It's taking years to get this right. Okay, ethical issues. So they've been using humans where they didn't have a choice back then, I think in the early 1900s and earlier, where they didn't have a choice in these and where they were just using them as experiments and not really giving them a choice. Hypothermia, tuberculosis, any disease that was coming out, they would be using them on the humans without their consent or forced, obviously. And the AIDS epidemic, same thing. Bone marrow treatment for advanced cancer. Women were doing this because they wanted to find a cure. If they were at the highest stage of breast cancer, they had no option. And so a lot of these past has helped us for the future or right now. Okay, new rule. Now there's a consent form. The institutional review boards has to be accountable and aware of these importance of clinical trials, why there needs to happen for this, and so forth. Okay, so conflicts of interest in drug trials. Companies are required to conduct randomized control trials. This is important on a new drug before it can be approved. We know this. We're seeing this in the media. It has to be conducted randomized control trial before it is approved. Okay, harmful side effects have also frequently become obvious after drugs were approved. So they're seeing different side effects with people. That's just what happens because some people react to it differently than others. Okay. There are evidence that drug companies sometimes suppress negative findings. Unfortunately, all clinical trials must be registered in advance in a public database. So very important slide here. Be aware of this, highlight it, review it, look in your book as well. So that was chapter 6. All right, so now we're getting into 7, talking about statistics. You, if you're going into nursing or any healthcare profession, you're going to be taking statistics. So if this is new to you, that's okay. It's very complex, but that's okay. We're just kind of going through it briefly. It's the numbers. Okay, so think of statistics like football. Okay, if you watch football or any type of sport, they're taking stats. That's statistics. They're taking numbers to see the probability of that happening, those numbers of other people, other players, stats of the past, and now to the future. So statistics, think of numbers. Okay, making sense of uncertainty. Okay, so learning objectives, how statistics are used in public health, we'll go over that. Indications of sources of errors that influence epidemiological study results and provide samples of studies, demonstrates the effect of probability, establishing the outcome of a clinical trial, explain the importance of screening tests in detection of treatment of a disease, so the importance of those numbers, okay? Why statistical rates are useful in interpreting the data collected for assessment of public health, and illustrate this scientific assessment of risk conflicts with the public for perception of risk. So these are trying to figure out the numbers. The numbers are key. We look at the numbers to see, okay, is it going the right way? Is it showing a correlation? We need we need numbers to have evidence, right? All right, so statistics is a set of concepts and methods used to analyze data in order to extract information. Makes sense, right? Is science used to interpret the numbers to demonstrate the health of a population, makes possible the translation of data into information about causes and effect, health risk, cures of a disease, and more. Okay, so statistics is crucial in public health. It is needed. That's where we get a lot of what our numbers for our data. Okay, uncertainty of science. Okay, most science is of probable nature. Okay, in many cases, there's not enough data to give us a degree of certainty, or existing data is not allowed to valid confusion. So a lot of times, especially in nutrition, we think, oh, this diet helps, that one, maybe go on this, maybe go on that. It changes constantly. That's the thing with healthcare. That's the thing with science. It changes constantly to keep up. And unfortunately, that's just how it goes to figure out the right solution. Okay, science is ongoing. Studies may contradict each other. That's just what it is. Science of statistics can qualify the degree of uncertainty. So those numbers can show certainty when there is no certainty. Okay. Probability. So this last slide, review and know this, because a lot of these slides obviously quiz. All right. Probability. The probable of being used of usually what happens, what will happen. Probabilities are used to describe the variety and frequency of past outcomes under similar conditions as a way of predicting what should happen in the future. So the probability of you getting this, or the probability of you getting that number versus, this. So it's the probability of something happening. Okay. So understand these p-values. Less than 0.05, it is usually mean that the result is statistically significant. Very important. You will know this more in detail when you take statistics. When p is equal 0.05, there is still 5% chance that the result is wrong. Okay, so you wanted to get as close to that number as possible, or lower. Okay, key concept, confidence interval, law of small probabilities. So you will know this in more detail once you take statistics. Okay, power of study. There's a probability of finding an effect if there is, in fact, an effect. Okay, large numbers confer power. Okay, numbers are power. Studies with low power are likely to produce false negative results. Okay, just makes sense. You need the numbers. Statistics of screening tests, examples, mammogram for breast cancer, HIV test, newborn screening, more sensitivity, various specificity, false positives versus false negatives, okay? Lead time bias over diagnosis bias. Okay, so these are different screenings that are done with statistics in statistics to assess treatment, assess diagnosis, things like that. Okay, rates. Rates relate raw numbers to size of populations being considered, birth rates, mortality rates, which means death, mortality. Okay, other rates commonly used as indicators of community health are infant mortality rate, maternal mortality rate, crude rates, adjusted rates, age age-adjusted, okay? Group specific, gender specific, things like that, okay? Other calculated statistics, life expectancy, years of potential life lost. These are other calculations of statistics. Risk assessments, risk perception. So these are indications of events and exposures that may be harmful for humans. Estimates the probabilities of their occurrence, estimates the extent of harm that it may cause. For well-known risks, we calculate for historical data. For poorly understood risk, we must make assumptions. Risk perceptions involve psychological factors. You know, for example, for mental health, okay, what else is going on? It's an umbrella. There's a lot of other factors that can affect it, okay? Is classified on 2 scales, dread or knownability, okay? Cost-benefit analysis, this is important, weighs the estimate cost of implementing a policy against the estimated benefits, usually in monetary terms, money. Costs are easier to calculate than benefits. Monetary value can be what we put on a life saved, okay? Analysis is controversial. Cost-effective analysis compares the efficiency of different methods of obtaining the same objective, okay? So be aware of this slide, review it, things like that. Okay, chapter 8, role of data in public health. So we're going to learn about the different collection of data of health in Americans, vital statistics compiled by public health agencies, describe the functions of the U.S. Census Bureau, examples of statistics inaccuracies that can occur, surveys conducted with other government agencies and their purpose will illustrate this significant data collection to public health practice, summarize how technology is improving accessibility and availability of public health information. Also, we'll describe congeniality in crucial in the accumulation of personal information. Okay, so use of data, assessing the health of the community, raw material for the research, identify special risk groups, detect new health threats, planning of public health programs, evaluate their success, and preparation of government budgets. So a lot that goes into just the data part. Okay, collection of data, birth certificates, death certificates, vital statistics that are needs for data collection. Data transmitted from formal local governments to states, from states to national centers of health statistics and more. Surveys are source of data, and so forth. Surveys, national health interview surveys. These are other important surveys to be aware of. Be aware of these. Okay, how much data is necessary? There can never be too much data. Okay, data is crucial, important in developing surveillance systems. Data collected is used by federal, state, local agencies in all areas of public health. Public health problems are identified according to available data. Without data, experts can't recognize what an epidemic is starting and how to control it. Okay, accuracy and availability of data. Data collected is imperfect, okay, because there's so much to get through. Census is most accurate, still there are overcounts or undercounts. Information technology increases accuracy and availability. Information technology increases accuracy, um, and so forth. Public health informatics has improved the accessibility of public health information and public health workers and the general public. The CDC, most other federal and state public health agencies make information available over the internet, which you've seen over these past few months because they have to. It's for the public. Confidentiality of data. Governments have safeguards to protect information on individuals. Use of data involves removal information identity of individuals, so your information should be protected. Use of data requires permission granted by institution review board or data protection committee. Okay, so be aware of that. All right, now Quest of the Infectious Diseases, Chapter 9. Infectious diseases, major killers in the past. So these here, if you've seen, these are major infectious diseases. These are ones in the 1960s, all purified water, sewage, milk, improper nutrition, and personal hygiene. Okay, infectious diseases, agents, immunizations, antibiotics, and public health measures. So these are measures that are done. Means of transmission, directly from person to another, and more. Sexual contact carriers and more. So be aware of transmission, means of transmission, how people or things get transmitted. Okay, chain of infection. The transmission pattern is composed of links, pathogen, reservoir, means of transmission, susceptible host. Okay, you learn this in microbiology, how things are broken down, how chain of infection happens. Public health measures to control the spread of a disease are aimed at interpreting the chain of infection at whichever linked are most vulnerable. Okay, be aware of this. Interrupting that chain, kill the pathogens with antibiotics, eliminate the reservoir, prevent transmission, hand washing, quarantine, condoms, more. Okay, immunization. Public health measures, epidemiologic surveillance, tracking, tracing, immunization and treatment, quarantine if necessary. Examples, SARS, we've talked about, or you've seen it, rabies, things like that, examples, okay, and more. Eradication is possible if there's no non-human reservoir, if a vaccine exists. Smallpox in the 1977, polio from Western Hemisphere now is only in a few countries. There is a religious opposition in some countries. Measles is the next target. Okay, so being aware of this slide. Fear of vaccines. So this is a big controversy. Rumors spread of vaccines causing autism and SIDS. Side effects do not exist for some vaccines. Some parents refuse to accept risks. Herd immunity is lost if many people do not get vaccinated. Pharmaceutical companies replicant to develop a vaccines, low profit, risk of lawsuits. Okay, and these are highlights that I want you to pay attention to, review on for your own studies. So please review this highlight slide. Okay, go back to it. All right, so now we're jumping to chapter 10. Okay, so assurance of infectious diseases, very important subject here, very important chapter. Okay, the course of infection of HIV and AIDS, and name the public measures established to control its transmission, illustrate the spread of Ebola epidemic worldwide, list other new or urgent viruses, and the environmental factors responsible for their emergence. Explain how the development of lethal strains of bacteria has led to antibiotic resistance, very important too. Explain how drug resistance affect the treatment of infectious diseases. The prion disease, identified in humans and animals described, resulting in public government restrictions, and act to strengthen public health system. Okay, and lastly, public health initiatives that address the environment, demographics, social, and other factors leading to emergence or reemergence of infectious diseases. So paying attention to these chapters in this last chapter is understanding how viruses happen, how infectious diseases happen, how we can do to prevent hand washing, hygiene, isolation, things like that, paying attention to those things. Again, we need to live our lives, but being aware what can help prevent the disease. Okay. Okay, so AIDS was first recognized in the 1981. It is now a worldwide killer caused by retrovirus. Attacks the immune system. Screening recognizes antibodies. We can measure viruses in the blood, and now many drugs are available, but again, no cure. Okay, transmission, sexual, homosexual, heterosexual, most common around the world, sharing needles, etc. Okay, transmission, mother to infant, prenatal, during birth, breastfeeding, blood transmission, no longer in the US. Circumcision helps protect men against contracting HIV from women, but does not protect women from contracting it from men. Very important slide. Okay, so HAART is a drug combination that has been done to help improve survival rates. Again, it is not a cure. Encourages infected people to be tested and treated, preventing transmission. Infusion inhibitors, and so on. Okay, where did it originate? Probability origin in Africa, transmitted cross species from monkeys to apes, spread in human population due to disruption of traditional lifestyles. Spread to Western countries due to change behaviors of sexual behavior and international travel. Okay. Other emergency viruses, we've seen this. Again, COVID is not listed on here, but again, it is on here, or it is merging as we know. Factors that lead to emergency of new infectious diseases, human activities that can cause damage in close contact with wildlife, modern cultural practices, agricultural practices, international travel, international disagreement of food, and exotic animals, breakdown of social restraints on sexual behavior, intravenous drug use, etc. So this is how things are. Influenza is an RNA virus like HIV. Virus is constantly mutating. Vaccine must be changed frequently. New lethal strain appeared periodically. Epidemic 1918, 1819 killed 20 million to 40 million worldwide. Bird flu, H1N1 are concerns. I would like you guys to read up on these other new bacterial threads. Please watch these. Again, I'm trying to make this as not too long of a lecture because I don't want to lose you guys. Antibiotic resistance, please watch these videos. Very important on antibiotic resistance and overuse of antibiotics. This happens a lot. I know many doctors, they need to read up on this too as well. All right, how antibiotic resistance occurs. Number of bacteria, a few of them are resistant to antibodies because they're taking so many antibodies. It kills a lot of good cells and bad cells, but mostly good and bad, both. Again, for you guys to review on. And tuberculosis is leading cause of infectious disease death worldwide. 1/3 of the world population is infected. People with HIV are much more higher risk. Tuberculosis transmitted. Fatal is about 50% for untreated. Okay. Antibiotics are effective but must be taken for several months. Improper use of antibiotics leads to resistance, including multi-drug resistant. Okay, prions, review this. Okay. Public health response to emerging infections, global surveillance, improving public health capacity, veterinary surveillance, reduction of improper use of antibiotics, Institute of Medicine, new vaccines, new antimicrobial drugs against vector-borne diseases. Okay. Threat of bioterrorism. Approach to bioterrorism, same as that for natural disease outbreaks. Bioterrorism will probably first be recognized by surveillance. First sign of attack are likely to be seen by physicians and hospital emergency room staff. Okay, very important. All right, so I went through this very quickly, but again, review. These are just highlights. Review in your book. I will have questions and videos for you guys to do on the discussion board for this week. and then you will have your first quiz, 30 questions, 30 points. Look back on your PowerPoints, your book, your videos, and you will do really well. Again, you get 2 attempts. I gave you extra time and a half just for you guys. Not too much time because I want to make sure that you guys know this information too. Um, and please email me if you have any questions or concerns. Very important chunk of public health. Okay, so this is week 2. I hope you guys have a good rest of the week. And please let me know if you have any questions or concerns. If this is something that's new again, that's okay. Just review. Don't give up. Okay, this is very important stuff. That's why I gave you the videos, additional videos to watch and study on to help keep you informed and to give you more of a breakdown of each of these areas that I want you to. So please watch the videos, please review. Again, yeah, it takes like 8 to 10 hours a week that I'm looking at for you guys to study, to put the time in. Again, this is only 8 weeks, very short. Usually they have this in 16 weeks, okay? But you're doing it, all right? Let me know if you have any questions, and I'll talk to you guys soon. And I hope you have a wonderful week, all right? Bye-bye.